Hello, this is Jacqueline Eckern with Eating Disorder Hope, and today I have the honor of interviewing Dr. Joann Wright. She is the Director of Clinical Services at Timberline Knolls, and we are delighted to be with you today. How are you, Joann?
I'm doing great. Thank you so much, Jacqueline. I really appreciate you inviting me here today.
Well, it's wonderful to chat with you. So could you tell me initially a little bit about Timberline Knolls, its mission and treatment philosophy?
Yeah, so our mission statement is making a real difference by serving with uncompromising care, relentless compassion, and an unconditional, joyful spirit while helping residents help themselves in recovery. And we do that in many different ways. We serve people with complex co-occurring disorders, eating disorders, substance abuse, mood disorders such as depression and anxiety, trauma, personality disorders. And as you can imagine, a lot of these disorders occur together. And so we treat people holistically.
Well, it sounds like because we know at Eating Disorder Hope that so many co-occurring issues exist with eating disorders, it sounds like TK is a great place to address underlying or co-occurring issues.
Yes, absolutely. And we have residential treatment. We also have PHP treatment. And so people can get the level of care that they need in order to serve this very complex, difficult time for them in their lives. And so they can move forward with some new tools, with a new perspective and a new attitude toward their life so they can make a meaningful life for themselves.
Wonderful. So tell me a bit about your background, books and presentations you've done.
So my background, I graduated from Hofstra University with a PhD and started using DBT. I first read about DBT on its inception in 1989 and started using it in practice in 1991. So I have a long history with DBT. And then with acceptance and commitment therapy, or ACT, I started utilizing that in the early 2000s, and that's really my passion. I love DBT. DBT and ACT work very, very well together, and so it's so nice to work in an environment where I can blend my two passions of ACT and DBT. I've been presenting nationally and internationally, workshops, supervisions, etc., with ACT since about 2006, and I present 2 or 3 times a year, usually nationally and internationally. I have 2 ACT books that are aimed toward clinicians. I co-authored these books, one for how to use ACT in the group setting, and the other one is how to apply ACT to yourself while you're being an ACT therapist.
That's wonderful. And we're getting those uploaded onto the Eating Disorder Hope site so you can check out those books. You can also find them on Amazon. And can I have the titles of the 2 books real quick for those who are listening?
Yes, Learning ACT from the Inside Out is the one for how to apply it to yourself, and Learning ACT for group treatment.
Excellent. Thank you. I will check those out personally.
Thank you very much.
Yeah. And regarding TK, what are the different levels of care and how do those work?
So we have residential and PHP, or partial hospitalization program. And so our residents oftentimes will start in the residential treatment program, where they get programming every single day, 7 days a week from morning till evening. And that looks like we have individual sessions, group sessions, family sessions, DBT and ACT. We use recovery principles. We have a spirituality component, and we have expressive therapy. And this is all done in a trauma-informed environment. And so the residents of Timberline Knolls are taken care of from the moment they wake up to the moment they go to sleep. And as you might imagine, some folks come in just not quite prepared for facing some of the things that they have been having to deal with. As you know, with the complex co-occurring disorders, people are really kind of lost in what they need to do and where they need to go. And we work toward creating that meaningful life for them. And we utilize values-based therapy. And that would be where the DBT and ACT comes in, where we say, what do you want your life to look like? Where do you want to go? And then we help them with how to get there.
That is so wonderful. I went into treatment at 28 and I'm 53, so this was eons ago. And back then, the therapist I worked with that led to the eating disorder hope, me being a therapist and everything, was to have a value-based perspective.
Yeah.
So the fact that you're bringing that out in your clients and helping them discover a meaningful life can change their whole lives. It's really exciting.
Absolutely. I was working with a young woman just the other day, and she had her head buried in her knees. She was just so lost. And I just said to her, what do you want your life to look like? And she lifted her head and she looked at me and she said, wow, I've never really thought about that. I'm like, let's think about that together and figure out what you want your life to look like. How do you make it meaningful? How do you make it a life worth living?
Yes, and that's why treatment is so valuable, because you can get down and really look at the, the underlying issues and the values. I would say it's such an important stepping stone to a new life. So it's not, it can feel like it's the end of the world going into treatment, and yet a whole nother life could lay on the other side if you do the work.
That's exactly right. That's exactly right. It is just so empowering to recognize and realize, maybe for the first time in one's life, that I can create my life.
Yes, yes, that's so encouraging to hear. And right now, it's a really unusual time, as we all know, with the coronavirus. How are you guys addressing that? What proactive initiatives is Timberline Knolls involved with?
I cannot tell you how proud I am of how TK has managed this. It's unbelievably. We have a core team who has been working day and night and updating policy and procedure as things change. As you know, this is rapidly evolving and changing minute by minute. And TK has done an incredible job to keep staff and residents alike safe. And I often say I worry more about my husband, who's working from home now. I worry more about him going to the grocery store than I worry about me going into TK because they have, every staff member has to have their temperature taken before they walk on campus. If a resident has even a sore throat, we put the resident in isolation until we know that the person is safe. We wash our hands constantly and continuously, and we keep ourselves safe and the residents safe. We have, sadly, it means that we have had to limit visitation for the time being, but our IT team worked like tirelessly to make sure that we can have video sessions so they can visit with their families over video. And
Right.
likewise, unfortunately, with anybody that would normally come onto campus, we limit that. And so for the time being, it's a shelter-in-place environment, and they're just doing beautiful work. I feel extremely safe, and I feel very confident that our residents are safe as well.
That's good to hear. It's an interesting time where we're all sort of on a break. So reflecting back on my own experience with treatment, this wouldn't be a bad time to go to treatment. You're safer there probably than you are out in a grocery store, and life has slowed it down.
Yes, and I absolutely agree 100% with that they are safe. I worry more about them when they go home than when they're with us.
So I also know that TK has a very robust alumni program, which is so important because people are just starting their journey when they leave. Can you tell us about that?
Yeah, and it's known, there's statistics around that first 3 months out of a residential program is the most vulnerable. And so it's great to connect with people who have been through the program, who understand what that journey is going to be like. And we have this really robust alumni program. And unfortunately, right now we're having to suspend it because we can't have the alumni come onto campus right now. But they do have a Facebook presence, and there are several thousand people on the Facebook alumni site, and so they can still stay in touch and still talk with each other, share their stories, share their journeys, be encouraging, help them with coping skills that, again, they might be really vulnerable because they were in, what we kind of call the TK bubble, where, you're in this protected environment, and now you're back out in the real world. And so how must you operate now without, the confinement of Timberline Knolls? And so the alumni are just fantastic at sharing that information. And I get excited when residents, graduate out of the program and they're like, I want to be part of the Alumni Association. It's like, you'd be a great person to, really help our residents get through that process of coming out of their residency and back into home environment. And so I'm very, very proud of our Alumni Association.
That sounds wonderful. What else, before we go, should we know about Timberline Knolls?
I'm just extremely proud of their excellence, of the hard work that everyone does there, whether it be the medical staff, the nursing staff, the clinical staff. Just everyone works together beautifully. It's a team treatment approach, and we all have all of our residents front of mind to give them the best care we possibly can.
One last thing I'd like to ask about before I let you go, because I know your time's so valuable, is your trauma-informed care. Because I know so many of the people that reach out to us on Eating Disorder Hope have different levels of trauma that they may have never dealt with. How does that work? I know you mentioned the DBT. Can you tell me what's special about TK and trauma?
So TK staff has been educated on trauma-informed care, and they realize that some of the behaviors that we see that might not be explained any other way could be explained by trauma. And so we're extra sensitive to understanding that some of the behaviors that we see that other people might not be able to understand, if we've got in front of mind that this could be trauma-based, it's easier for us to support that resident and get behind them and say, hey, they're coming from a trauma place. And it invokes a lot more compassion when we recognize that their behaviors often are coming from a trauma place.
Yes, and teaches the client compassion for self.
Yes, yes, absolutely. Absolutely.
So if you are watching this and would like to speak with Timberline Knolls, you can call 877-217-7456. They have admissions staff available to talk to you and help you sort through your insurance or figure out what kind of treatment's right for you. And if it's not right, they can refer you elsewhere. Additionally, you can visit their website at timberlineknolls.com. And thank you so much, Dr. Wright, for your time and insight today.
Oh, it was such a pleasure being with you today. Thank you so much for inviting me.